Hello guys, welcome to basic nursing classes. Myself Amanpreet. Today we are going to move on with our topic alkalosis and acidosis. Okay, and in this video we are going to talk about ventilators and the conditions which can lead to acidosis or alkalosis through the ventilators. Okay, so in ventilators, the respiratory alkalosis or acidosis they can develop. Why only respiratory? Because we all know through ventilators we give the artificial breathing. Okay, the patient who can't breathe on their own. So it's an artificial way of giving the oxygen to patient. So it's related to lungs. So it's respiratory. So the main thing by which we can know the patient can go either into acidosis or alkalosis, that is by alarms. So all nurses who have worked in the ICU setting, they all know about the alarms. There are mainly high pressure alarms or low pressure alarms. Okay, so let's discuss first the high pressure alarms. The high pressure alarm means when the machine has to push oxygen too hard to give the air into lungs. Okay, the machine has to put extra effort to give the desired level of oxygen into the lungs. Okay, so obviously if the machine is giving the oxygen too by putting too much pressure, so it can damage the lungs also. There can be lung injury. Okay, so we obviously have to look upon the high pressure alarms. If there is increased resistance to the airflow, okay, then only there can be high pressure alarms, because only there, if there is resistance, then only there will be obstruction. Okay, and there are three main ways through which we can look for the obstruction. The first thing is we have to look for any kinks in the tube. Okay, second is we have to look for any water condensation in the tubing. Okay, normally we can see in the ICU setting, in the tube ventilator tubings, there is water condensating in the tube, so we have to take that out, empty it out. Okay, the third thing is mucus secretions. There the patient's airway, too much secretions are getting produced, so you have to clear the airway. Okay, so for the kinks you have to get the kinks out, and for water condensation you have to empty the tube, and for mucus secretions you have to clear the airway. Now how do we clear the airway? So we all think we have to suction it, but suction is not the first thing to do. Okay, so firstly we have to turn the patients. Sometimes if we turn the patient, the secretions they come out. Okay, then you can clean the airway. Okay, the clean the secretions, and then that's fine. But if by turning the patient's airway is not clear, then if the patient is conscious, you can give the instruction to cough. If the patient can cough, he can take out the secretions. And third thing, he can deep breathe. Through deep breathing also he can take out the extra secretions out of the airway. But if all the three ways they are not working well, so at last you have to suction the airway. Okay, so suctioning is not coming at the first level. We have to suction at the last level when all the other things are not working out. Okay, and high pressure alarms, they can lead to respiratory alkalosis. Okay, and now let's move on to low pressure alarms. So low pressure alarms, it's opposite to high pressure alarms. It means it's too easy way for the machine to deliver the desired peak level oxygen to the patient's lungs. So it means there's a decreased resistance, okay, to airflow. So why decreased resistance? It means there is some disconnection in the tubing. Okay, either the main tube is disconnected or the oxygen sensor tube is disconnected, so you have to reconnect it. Okay, so this is only reason behind low pressure alarms. Okay, and low pressure alarms, they can lead to respiratory acidosis. Okay, because the carbon dioxide is accumulating inside the lungs, it's not coming out. Okay, through the lungs, it can lead to high levels of carbon dioxide inside the body, so obviously acidic condition. Okay, and the other conditions in ventilators which can lead to respiratory acidosis, that is low setting. When the ventilator setting is low than the desired level, it can lead to acidosis. And moreover, when we are extubating the patient, okay, or weaning off the patient, then also the patient can go into acidosis, because too early weaning off, by too early weaning of the patient, too much the carbon dioxide which has to come out through the lungs, it's not coming out, it's accumulating inside the lungs, so it can lead to acidosis. Okay, and for the alkalosis, the other reasons can be if the ventilator setting is too high than the desired level. Moreover, when the patient is coughing or gagging, there is too much gag reflex. Okay, so by coughing and by gag reflex, there is increased resistance to the airflow. Thirdly, if the patient is in pain, okay, if the patient is in pain, so there can be increased resistance. Okay, and third thing is anxiety. Anxiety can also lead to respiratory alkalosis. Okay, because in anxiety and in both in anxiety and pain, the sign and symptoms will go up. Okay, and if they are going up, they can lead to respiratory alkalosis. Okay, we have earlier discussed about anxiety and pain. Okay, so this is the main thing you have to remember in the ventilators. Okay, good luck for exam. Thank you.